My name is Tom Ardolf, and I have a company, Cybermation, in Wade Park. We would be considered a systems integration company. And before I get started, I just want to share that I think after I started my first technology business in 1986, started Cybermation in 1996, 2000, I built a technology center there, and I have a feeling that I've been somewhat of a technology evangelist, saying that the internet is really the fifth utility, and it should be ubiquitous. It should frankly be there more than your plumbing, your electricity, because we need it in the air, wirelessly, we need it to plug it into the jack, and so my moniker has basically been calling it the fifth utility for well over a decade, and I feel I'm finally with some folks that can actually literally understand that, so I'm really appreciate the opportunity to be here today. I actually am here and became aware of this primarily because of a Blandon Foundation project that was very successful, actually a healthcare opportunity that a company, LA Home Care, I was just a vendor, a company, LA Home Care, and Leslie's actually here this morning. Hopefully she can share a little bit of her experience with what took place. Is that as a vendor, we provided a product that requires the internet. You know, that kind of the POTS, the plain old telephone service for a lot of the healthcare things are really, it's out of vogue, it's out of style. I mean, these days, it's a cellular device, it's an internet device, something like that. And so our device requires an internet connection to be, to provide the services, and it is a device that literally provides clinical, prescription, oximeter, those types of devices, activities of daily living tracking, a socialization tool, because if the mental health isn't there, the physical health isn't either. And really through the product, as well as the extraordinary services that, the skilled nursing services that LA Home Care was able to provide with that person, someone 90 years old with dementia was able to stay in her home for an extended period of time. And I think it, look at it on a quantitative basis if you'd like. The money that was saved by having that lady stay in her home far surpassed what the cost of that system was. Qualitatively though, statistically 89% of seniors want to stay in their home basically until they die. And instead, we're taking them out of there because we feel that we need to do something different. They want to stay there. Let's find a way to do it. So look at it from a quantitative basis or a qualitative basis. What was done by LA Home Care and through the technologies of the GrandCare system, actually the product that we represent, we were successful. And so, and I've seen it time and time again. You know, we really started the telehealth or the cyber health division of our company just about 2 years ago. We're relatively new to it, even though we've been doing technology since Cybermation since 1996. And you know, since then though, I've become well aware we're really using the core competencies of our systems integration business. We're just applying it in a different angle. Gotta admit though, there's no doubt. I mean, I frankly used to sell big boys toys, and people would write me a check, and now suddenly when you have to deal with selling a healthcare system that has to be government funded through an elderly waiver program, I have to tell you, if people taking it back to our governor, there's some really difficult ways of being able to get these things approved, to be able to get them funded, and as a result of that, it's been the toughest challenge that I've had during the entire process. Now, I actually met with Steve Galtwald, as head of the governor's healthcare reform task force, and I brought him into our office to say, yeah, Steve, maybe you would like to know a little bit about this. And completely, you know, he's incredible, he said, you know, I need to show people this. I mean, it goes to show that we're kind of on a new era of using technology. And when you look at our society, we've used technology to solve problems all over. I don't care if you were building automobiles or guns in the Old West or whatever it is. Technology has been the single driving factor to make something better, stronger, faster, more efficient, more effective. And through the use of it, not to replace the human aspect of healthcare. I don't think anybody ever wants to do something like that. But through the use of it as a tool, like we do with so many other industries and business models and stuff like that, telehealth needs to be here. Let's face it, with GDP getting hit up to some, I think, by what, 2015 is what, about 70%, healthcare is 17% of our GDP. I think by 2025 it's somewhere around 25-30% or something like that. I mean, that's frankly an unsustainable track. We know we have to do something. And I recognize that the Healthcare Reform Act already has things in there that's going to help those types of things along.
That's 5 minutes, but why don't you finish up your thought and we'll...
Absolutely. I can finalize it, I guess, is that we just see the use of the broadband and internet everywhere. And I'll toss out something that came to me when I was actually sitting in the chair there. In our company, one of the newest things is many small electronics devices actually are what are called PoE, Power over Ethernet. You realize we've replaced the AC power lines in many of our systems by using an Ethernet connection to be able to actually generate the power and use it because of the low wattage and power consumption. So the internet, if you will, through an Ethernet cable has literally become the new electricity conduit in our homes. So, thank you.
Well, let's stay here.
Oh.
Just, I wonder if anyone has any thoughts or clarifications, questions for Tom?
I just had one more.
Sure.
What sort of bandwidth do your system require?
That depends on the device. I mean, surely we need to see at least a 1 meg connection to be able to be effective to bring things. In general, the consumer electronics type things that we have, let's face it, the reality is video, TV broadcasting is going to be a thing of the past. I mean, everything's going to come over the internet one way or another. And so the content gets bigger, the speeds need to get bigger. You know, I know a number of the initiatives that we're looking at being able to have 15 meg, for instance, at the homes by 2015 or something like that. Some of the Blind and Foundation initiatives, I think, is a good target to have.
So Tom, I wanted to ask you, absent, you know, just from a financial point of view, absent the public dollars, the grant dollars that you received in part through the American Reinvestment and Renewal Act, whatever that was, the ARA funding, and that we were able to make available, is there a business model out there for you to do this, other places that don't benefit from charitable dollars?
There is. As a matter of fact, I don't know if anyone saw the piece on Care 11 last Monday, but Care 11 came out to one of my customers, and the reason I was there was simply because I was the vendor, but it was about a healthcare organization actually in Savage, Minnesota, that sees this, at least today, as a competitive advantage. She sees it as a way to deliver new services in her business for a couple of reasons. Partly because the dollars are getting cut through the elderly waiver programs, as well as a way to make her business more efficient, is that she can deliver a telehealth solution that both differentiate herself from other home health care service providers, as well as provide a revenue stream, frankly.
I'm curious if you could talk just a little bit more about the elderly waiver and how difficult it's been to be able to navigate that system. I think that's something that there is a governor's initiative that's also a cabinet level initiative on broadband, and that could be something that would be of interest to them. And Assistant Commissioner Ehlers is working with that group, and so I think this is something that we'd want to know a little more about.
Absolutely. Two big things then that I'll point out to be brief about it is, the first thing is because our device is an internet appliance. It means by virtue of being connected to the internet, I can give you content off of the internet, basically at no cost, if you will. You know, RSS feeds and various types of things. Well, as soon as I deliver a piece of equipment to a customer that provides internet content, it's like I just literally turned down the deal to be able to do it. I can't sell the system, if you will, and mention that I can provide a degree of socialization to my customers because the government wants to reimburse my customers for people to take care of their clinical needs, things like their prescription dispensing and checking their blood pressure and checking their glucose. That's fine, we'll do that. They'll pay for that. They'll also track their ADLs if they have things like dementia, and so they're monitoring, and we can detect that monitoring. The thing is show me someone in the healthcare field that says it isn't important to take care of the mental health. As a matter of fact, you can generally find like a fraction of a sentence in the rules and regulations that will say that we need to take care of mental health too. But I tell you what, to get the approval for the waiver program is almost impossible as a result of that. So that's the one key thing. The other difficulty I had is because and this is really more respective to our veterans, which I think is a very important population to address too. Because counties are a resource of last resort. If the VA can provide some element to them to take care of very specific clinical needs, the elderly waiver program, the counties will say, no, I can't, we won't reimburse you, we won't let you buy the system, because the VA can give you a blood pressure cuff or a glucometer or something like that. So once again, we're dealing with these silos of things. No one's taking a more holistic approach to looking at the health care of the individual to really be effective in the long-term health care of that individual. You know, it's like, let's put the Band-Aid on and take care of his glucose. Let's put the Band-Aid on and take care of his blood pressure. But that isn't really how we keep somebody healthy. Watch that broadcast. I mean, if you don't like, if instead of my testimony, listen to my customer's testimony. Go to Care 11 and just search on GrandCare and Cybermation.
We'll find that and do that. Tom, thank you so much for coming up and